Hi, everybody. Welcome to this episode of the One Thing podcast. I'm your host, Dr. Adam Rindy. In today's episode, which is episode 104, we have the honor of hosting a truly remarkable guest, Dr. Amanda Lynn Hoffman. Dr. Hoffman is the first naturopathic physician with Marfan Syndrome to specialize in this field. Dr. Amanda Lynn offers valuable insights for both individuals living with Marfan Syndrome and their caregivers. As a naturopathic medical student, she wrote her clinical thesis on Marfan Syndrome about her personal journey, and she has compiled this information not only in a booklet for many people dealing with Marfan Syndrome and other connective tissue disorders. She's also now a specialist helping patients deal with the day-to-day quality of life issues related to Marfan Syndrome. In this episode, we dive deep into the world of Marfan Syndrome, exploring key questions such as the biological drivers of Marfans. We understand the genetic and biological underpinnings of the syndrome. We discuss symptoms and findings, the unique cardiovascular sequelae that is dealt with in Marfan Syndrome, including surgical interventions that are given to Marfan's patients. We discuss the emotional and physical journey of dealing with day-to-day life of having Marfan Syndrome and holistic approaches that can improve the quality of life. There is some unique physiology that we get into about what happens in the body when someone has Marfan Syndrome, and we'll discuss ways that is addressed in this episode. This episode had special significance as it was recorded just before Dr. Amanda Lynn underwent her David 5 heart surgery, and we discussed her thoughts and experiences leading up to this major surgery. And I'm thrilled to announce that Dr. Amanda Lynn is now recovering from her surgery and appears to be doing well post-surgery. And this was such an honor to be able to discuss the upcoming surgery with her during our discussion. So whether you're a medical professional, a caregiver, or someone who's living with Marfan Syndrome, this episode is extremely valuable, has good knowledge, and also I think just hearing from Dr. Amanda Lynn is quite inspiring. I will mention that we have done a special thing for this episode. We put a link to Dr. Amanda's support guide for all things that are generally not talked about with Marfan Syndrome patients. She also, in this booklet, talks about vascular Ehlers-Danlos syndrome and Ehlers-Danlos syndrome and hypermobility spectrum disorders. And this link will be in the show notes for you to download. Also, if we hit 300 listens within the first 30 days of this episode launch, the One Thing podcast will make a donation in honor of Dr. Amanda Lynn to her favorite nonprofit right now, which is commongroundscollective.com, which benefits those who were affected in the Maui fires. And so proceeds and a donation will be made in her honor by listening to this episode. So I really appreciate you being here. Please share this episode and subscribe to future episodes on all your favorite podcast players. And without further ado, welcome to the next episode of the One Thing podcast.
This is the One Thing podcast, and I'm your host, Dr. Adam Rindy. The One Thing podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition, Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. Dr. Amanda Lynn, welcome to the One Thing podcast. It's great to have you here with me.
Wonderful to be here. Thank you so much, Dr. Adam.
You're welcome. Yeah, so it's been great getting to know you a little bit more offline here, and there's just so much to share. And one of the things I'd love to kind of hear, because we didn't really get into this, is just to hear your journey. We're going to learn a lot about Marfan's, and I'd love to just kind of hear your journey with Marfan Syndrome and take us back to this part of your life and when it started.
Oh, yeah. Happy to. Me growing up in a small little rural part of Oregon, I was pretty lucky we were close to OHSU. Definitely. Lynn had already found the fibrillin gene at that time, and the hub was definitely going on up in Portland at OHSU about Marfan syndrome, and down in Palo Alto at Stanford were two of the big hot spots. If you were going to need support, those were the places to go. But it wasn't until I couldn't see very well in like second, third grade, they started to pick up like, oh, she's squinting a lot and not quite, being able to read the chalkboard, what's going on. So it was actually like a lot of us, it's our ophthalmologists or optometrists that are finding our diagnosis of Marfan's happening, which is pretty cool. I guess it's the dancing iris, the fluttering iris that really is very unique for us. And then they go in a little further and they're like, oh, you're only looking through a sliver of your lens. What's going on here? Because usually the loose microfibrils will pull you to the side one way. I was pulled, so they were way up here, and I was just always looking down the bottom edge of my lenses until just 2 years ago. He had referred me to go get worked up at OHSU.
And you were what age at this time?
I was, 8 years old. Exactly.
Okay.
And, so I was far enough along that, and I didn't have it as bad that I skipped over like all the casts that they did to all my siblings to try and fix their funky fallen arches, and I never have had the fallen arches. I've had the high arches. So boom, I was like in ballet, right? They say 30% of dancers have some kind of hypermobility with their connective tissue because it makes us naturally really great dancers.
Yeah.
Right. So I always love that they're getting more aware of that.
Do you remember how you were processing this as an 8-year-old? Was it kind of like, okay, let's do this? Or were your parents worried? Do you remember kind of like there being some anxiety around the diagnosis?
Not really, because it was all so new. My parents were probably pretty good at like keeping things away from me. They were really drilling like the heart stuff. I don't even remember an ultrasound. Luckily, ultrasounds are so uninvasive that it's a pretty easy one to keep monitoring for us. But what became a real pain was I had to do, my eyesight was just going down fast. And they decided that putting me in contacts. So by 4th, 5th grade, I had to start putting contacts in. And that was definitely like, are you serious? Because they thought that it would physically help hold the shape of my eye, because our eyes just tend to go like long and skinny, because conventional medicine has really kind of been grasping for what can help for us for a while. We find some things and then we go at it for a little while and we're like, oh, dang, that worked great on the rats, but not on us.
Yeah.
But
so
no, I think my mom probably hid that back. My parents didn't quite get it because they let me play the sports I wanted to, because I was always a little athlete inside of this smart body.
Okay. And you mentioned like there was some concerns about cardiovascular health. Can you just highlight with Marfan syndrome, what is the main concerns? Because, there's anatomical aspects of the aorta and the mitral valve. Can you share more about like what the concern was?
Yeah, definitely. The main concern is the dilatation or the aortic root just kind of continuing to grow out too much. Now, as growing up and how we had heard it, it was like, oh, we're so stretchy and we don't have elastin that that's what's, happens. But then when I would go to the conferences and was in med school and I could understand what the newest stuff was and really the biomechanics there from Hal Dietz, the head a researcher for us for the most part, he was showing that no, the TGF beta that gets hyper triggered because not of enough fibrillin. So the fibrillin gene mutation actually upregulates trans beta factor A, and so that overexpresses. So that'll go in and overexpress our really long bones, overexpress these arteries to grow a little too much by laying down, messing up the ECM, our extracellular matrix, so bad that our body has to lay down scar tissue to reinforce that because our connected tissue is just so messed up. So like a cross look of our muscles is just all this unorganized layers. And so it's these unorganized layers of scar tissue that isn't stretchy, as we know, it's like stuck. That's why we'll rip and have the whole dissection that you hear about. That's the worst, right?
Okay, so like in those early days, were you going through a lot of imaging and cardiovascular tests?
They kept it from the most part. I looked good. So and they didn't have a whole lot and they weren't really pushing a whole lot back then. There were no medications. It was just once a year, you go get your echo done. And then we watch it. So luckily I wasn't growing, enlarging as they'll check on how big that is across.
Okay. And then what about like your spine and bones, and what were the discussions around that?
Right. It was growing up, really fast. You just shoot up overnight. I would wake up with feeling like I had to pull my ankles back onto my leg, and the bone pains there were just tremendous. And then I have very knobby knees, and it was definitely the ugly duckling of just shooting straight up and then being stick thin. And, so it was like the scoliosis, luckily, was not that bad on me. And I was in ballet class that only reinforced like keeping a good posture, which I know has really saved me to this day, thanks to my CIA ballerina teacher. She was behind the Iron Curtain and brought over Baryshnikov style Russian ballet.
Okay.
Yeah. And she would hit us with a whip anytime our butts are sticking out and everything. We're like, oh, okay. But now that way that's not helping me as far as pelvic floor health. But dancing then helped me like put together my movements easier too, because you're just so uncoordinated. We don't have that proprioceptor connection real well. So you might hear that we'll run into walls easier and we're a lot more clumsy. So that can be really tricky when it comes to trying to get through those puberty stages that are just uncomfortable anyway. But luckily I grow fast, and a lot of Marfans, we hit 6 feet tall, sixth grade. My son's 6'1" at 12 years old. And so the poor kids, you forget that they're still 12, and you're looking at them and they look like they're 15, 16.
Yeah.
Right.
Yeah. So did you go into dancing and ballet because of Marfan's, like as a way of dealing with it, or did you have a special interest in it?
Oh, that was a special interest, as well as an aunt that made sure that I redid all this stuff. And then she had amazingly been my mom's ballet teacher in Redmond, Oregon, which was like 4 hours away years before. But I guess when you're ex-CIA, you have to keep bouncing around to little small towns.
Kind
And
of
so,
stand out.
so yeah, he didn't touch a lot of stuff in her house. But it was definitely something that was like everybody thought would help with my coordination, I think, too. But I definitely love dancing. But that one was really disciplined for me. Russian ballet style, very disciplined.
Yeah. So
But I
you're
think it's
saying,
great. Sports are great for these kids, right? And we're told or be active and get the muscle on us is really important. But too many times, oh no, you can't do any sports. You have to put a million protective gear things on.
Mhm.
And I'm just really thankful my parents kind of let me lead that a little bit more and let me do all the sports I wanted. I mean,
Yeah.
and the long term, I think it was good overall, but I did displace a hip in a basketball game in high school and came down at totally pop a hip out. Like, who
Mm.
can do that? So ever since, this left hip has given me issues.
Yeah. Yeah. So you're saying like it worked in your favor to be sort of not held back and to kind of explore how your body moves in space and kind of work with your body versus being restricted.
Right. Right. And I think that helps the beginning of the template for me for not following all the standard of care that they've done for Marfans. I've
Yeah. I
never
think
been on the beta blocker or the ARBs.
so. How are you doing today with everything?
Well, today, so I've been able to keep off the heart surgery is pretty much something you're going to face at one point or another. You just hope it's planned and it's not an emergency.
Hmm.
And and so I have the luxury of knowing I have Marfans for one, and then keeping and having the ability to get in for an echo every year, and being close to great trauma centers. I do live kind of far from them. They didn't like it when I was pregnant. Those were definitely some bumps for the medical system with me. They wanted me to, not get pregnant. They don't want us having babies because this is a genetic disorder you shouldn't be passing along.
Hmm.
And then two, they really want C-sections because they feel that any of the, valsalva, any of that pressure on my heart was going to cause me to rip open. So, yeah, those are definitely interesting stories how I was able to get around that. But then, and even, dilated a bit when I was pregnant, which is very normal, very natural. And that usually does come back down again. And mine came back down again. And then when my little one was little, they were like, okay, you're getting, 5 centimeters is the magic number for how far they'll let that go. And then they want to do surgery. So I was like up over 5 pregnancy, brought it down to like 4.8, 4.7, hung out there for a while, but they've been wanting me to do surgery, but I've been pushing it off for the last decade. But now it's popped up a little bit. And I think, well, I better do it sooner than later while I am healthy and I can recoup. I mean, nobody wants to do this. Nobody wants to walk in and go, yeah, let's put the chainsaw to my chest and crack me open and
Right. Right.
cut out a slab and throw it on the freaking table.
Yeah.
So, but,
Yeah.
I do need a part upgrade. So I'm grateful for our heroic medicine.
Yeah. So, what do they actually kind of graph on a replacement, or how's the surgery work?
So it is, I luckily have a great surgeon who's very versed in this. He has done lots of Marfans, including members of my family. And it's called the David 5, Dr. David, in Toronto, Canada, created this cool option of tying it onto the aortic valve.
Mm.
So what they'll do, so that it's a valve sparing aortic root replacement. And the top of the aortic root is where all three of the big supravena cavas and,
Hmm.
stuff are coming in to the head of the heart. He's going to cut off right below that is where the big aneurysm and where the worst parts of it go. And like put in
Hmm.
this tube that is a dicron material. I mean,
Hmm.
it honestly looks like a Chinese finger trick thing,
Hmm.
but it's,
Yeah.
NASA material. And then he will hook that onto the outside of the valve ring with us. A lot of time, I'm lucky my valves actually look good. They're floppy, but they look good. But what's going off then is the shape, right? It's not staying perfect, and that's going to keep going off a little bit as you get older because we have big hearts and they still keep kind of getting bigger. But they'll put a ring in, so I don't have to get a valve replacement, which is really what we want to do. We want to do everything we can to not have to take rat poison the rest of our lives.
Right. Right.
Coumadin and warfarin
Yeah.
really downgrades that quality of life.
Yeah. So, yeah, it's amazing. Like my first son he was planned to have a surgery on his aorta, but that's a long story. But
Oh
it was
wow.
interesting to live with that expectation for a long time and to know it was going to happen at some point. And I'm curious, like, how you've held that. It's such a balance between living in the present, living in the future. And have you had to do some transform with that, like in some way personally to deal with that?
Oh yeah, definitely. When you have like it frees you up maybe to be more in the moment because you're like, I don't fucking know. I could be dead tomorrow. We
Right.
could rip in the middle of the night. I could
Right.
pick up the wrong thing. My kid right now, I'm kind of even more like concerned because I'm lifting him around. It was mainly after the angiogram. It's weird, right? But oh my gosh, yeah, definitely. I feel like us with Marfans naturally have this like flexibility of all kinds, flexibility of mind to be able and all of us seem to have this just kind of like sarcastic, maybe dark humor of how we get
Mhm.
through it. I have patients that are in Ireland and Britain, and they definitely are on that line with me because that's right. That's their humor anyway. But overall, we're just like more kind of compassionate too with other people and situations. So I think I'm like, oh, literally have a big heart. So I think there's something in the ability to just be chill about it. I mean, thank God we don't have that high level of anxiety that gets built into Ehlers-Danlos, and crossed over with the Marfans. Like, yeah, you could rip any day because I would be living on Valium, right? But it's amazing. I think though that has put me on more of a spiritual path than the doctor medical path, though. Really, for me, of why I have done a vision quest to being more open of a practitioner who's open for psilocybin support and things. So I know that like I feel like I'm going to be doing a little introspection here soon before my surgery because any kind of big thing coming up, it can help you get above that. And so I
Mhm.
think my early use of psilocybins and marijuana helped me get above everything and go,
Mhm.
yeah, life is, what it is. I'm going to get what I get. And a deep root in like my spiritual faith and stuff
Yeah, amazing.
yeah.
Yeah, you remind me a lot of one of my heroes in our profession, Dr. Leanna Standish. Do you know her?
Aw. No, I'm totally writing
Yeah,
her name down.
she's also a psilocybin researcher, and
Oh,
um,
cool.
she was featured in the movie Spirit Molecule, um,
Oh, yeah.
and she's up here in the Seattle area and longtime naturopath. Why I said that is you're like someone who, because of your ability to like steer like fearful things in the face and live with holding that, it's like I
Mm.
would want you to be my doctor. It's like
Thank
like
you.
someone like that. And like, in fact,
Yeah.
Dr. Standish is someone I've called upon on various really serious moments in my life because of just that quality of like being able to stay in the moment in fearful situations or situations that aren't predictable, like an orderly and straight line. Like that's such an amazing quality.
To stay in the unknown. Yeah.
Yeah, like I always call it like stay in the pocket, like
Hmm.
stay in the pocket of life. Like it's like
And just
maybe at
go
this,
around where it takes you. I like
yeah, like
that.
you're like you're able to kind of flow and versus just like check out. Polyvagal theory talks about shutting down and flight or flight responses, and
Yeah,
to be able to stay connected and here is like an amazing quality. I mean,
definitely
a
what makes
hidden
it
gift,
cool.
I guess. So thank you for sharing that because I've always wondered how that would be and actually have lived in a aligned way, but not personally. So with we've talked a lot about the anatomical effects and you talked a little bit about some of the biochemical effects of Marfan syndrome. Like are these elevations of inflammatory markers only in development or do they persist through life, or is there a biochemical like biomarkers you can pick up in the blood or inflammation markers you can pick up in a Marfan syndrome patient versus someone who doesn't have Marfan's?
That's a great question because I have found, as far as using, LabCorp Quest, all our basic ones, and even our really cool, outside the mainstream labs that we can utilize. The only thing really useful are the genetic panels.
Okay.
Because I don't come up with HSCRP. It's not elevated. I know I get that question a lot, like, oh, you should be on like SPMs all the time, to kill that inflammation. And it's
Mm.
like, yeah, we definitely want, monitoring inflammation as one avenue, but it almost seems like if everything is there and happy, then it's not even, it doesn't go to the inflammation. It just goes into its messaging,
Mm-hmm.
system of like, okay, grow, grow, grow. And just in the matter of all the stuff that has to happen in an extracellular matrix, then it'll grow. But I don't think we have enough inflammation markers yet to really go in. Or, I haven't been utilizing, specific cytokines like I really could for some things, but that's more because it's more of it's quality of life, and really the big marker is watching dilation, and then improving quality of life and just keeping everybody as there's a lot of fatigue that goes on and such. So we'll definitely watch that. Just random headaches because of the spinal fluid not flowing very well. And so I find that I'm the when pain comes up, then we're definitely going in and hitting with the anti-inflammatories. And God knows we got a lot of pain situations. The
So,
fibromyalgia times 10, I call it.
okay. Well, I'd love to get into the connection here in a second between other connective tissue disorders and Marfan syndrome. But kind of going further into that question that I just asked, has there been studies with like biopsies of tissue to look I know you're talking about the lay down of the tissue, but is there any immune cells that are more populated, or is there any clues that tells us like what's going on deeply with immune system interactions?
Right. No, that's a really good point, Doc, because we're constantly breaking ourselves down and rebuilding. So it's really like the deepest level of an autoimmune because it's
Mm.
on this connective tissue base in a genetic way where there's going to be, when there's some remodeling going on, then we're going to have that granular stuff kicked up, and we will be in that phase. So you could possibly find that out at times. But, even I will work with some doctors to do prolotherapy with my patients. And it can go either way with us, because if you're in a stage of like that remodeling is already happening, and then you'll go in and kick on some not really recommended PRP, because what do we want to reshoot our own bad cells into ourselves for? But maybe just utilizing the saline. And I really like just to do the little trigger point shots. But there definitely seems to be a point with that remodeling going on where it's a great time to do Prolo, and it's not a great time to do Prolo, and it can make things worse. But other times I see it be miracles and help those loose ankles that prevent somebody from walking be able to get up and move again, and really do huge for quality of life. So there's so little studies out there at this point. I'm having to be more like generally intuitive with it, or like, oh, are you having a high pain time right now? Okay, you're probably remodeling. Let's not, while you're in active inflammation, not do, say prolotherapy or something that might be a little bit more triggering of the inflammation pathways. So as far as no, I think we're all pretty excited that we just see these with MRIs and stuff, seeing that there is a kick of a breakdown of our own tissue, and then the scar tissue being remodeled in, and it'll definitely be kicked up a little bit more if there were a direct injury to the area, and we'll be more prone to like go keloid when we're healing up our skin, or not heal up your skin and have holes from an IV that are there for years. And so there's the healing it's like no rhyme or reason on some of this stuff too.
Yeah. So
they still call it a syndrome, a collection of like,
I was going to question
it's definitely
that.
a disease.
It doesn't seem like a good description. It's like something that just was discovered as like a syndrome.
Antoine Marfan found it out in 1840. I think it's been around a minute.
Yeah, exactly. So how do you see, you're seeing with your patients, like you're not only supporting the Marfan's community, but you're supporting connective tissue disordered community, EDS, and hypermobility syndromes. How do you see the overlap? Are they all kind of a family? Or are they distinct?
They're very distinct. We all used to be one family. And there's the treatments can be really similar for HSD, just the hypermobile EDS. But still not, EDS, now that we know with the histamine connection, really puts it in its own category. But yeah, they used to lump us all together, and we were just, the weird connective tissue clan. And as we dive in farther and farther, we're like, oh, okay, so you're, low elastin, really hypermobile. Okay, you guys all do have some similarities here. The pot stuff, luckily, is just usually over in the EDS category. The high anxiety, all these things with the high histamine. Now, I do see an issue with methylation being a problem too with a lot of Marfans. And I swear that's just because, and in hypermobility, because our receptors are all off a little bit. It seems like if there's one genetic thing wrong with you, there's going to be a couple more genetic things going on. I've found a lot of us have ApoE gene for the high cholesterol. So thank God for Oregon grapefruit. We love berberine, right? And
you find that to be helpful for ApoE?
Yeah, that's the only thing that's really found to stop the receptors from breaking down, which is again like a Marfan thing where it's a self breakdown. But ApoE can be, across the board. It wasn't until I was able to do a lot of those Boston Heart cardiovascular tests that, threw in the genetics, but was affordable for people to see like these great connections of like, oh my gosh, how many people have MTHFR, which,
Yeah.
tons of us do too. Anyway, that one. But then this ApoE, and looking back at my own family, we're like, oh yeah, that's why we have this skinny fat, high cholesterol issue. It's continually recycling
Yeah.
LDL and can't get out. Like, oh my gosh. So getting the
So
family all
important.
on that, and my Marfan people getting that tested and worked up. There's
Yeah,
some
that's so important, with just heart health in general. We're learning so much more about markers to look for, like ApoB, lipoprotein little a, to have something that, works on ApoE to lower LDL, just like one less burden.
You're going to see a pharmaceutical coming out with that real soon too, because they figured out
They
that
love berberine. Yeah. Yeah.
right,
Berberine.
for the diabetic stuff.
And pretty soon we won't be able to prescribe it if the pharmaceutical companies get a hold of it.
I know. We'll all be out digging out in the forest again. That's one of the first ones I learned how to make
It's everywhere.
as an herbalist. Well, they say we are the last good spots. I've been having people tell me, no, Oregon grape roots everywhere around you, but there is a berberine, like golden root plant in every continent, right? So if it's coptis to goldenrod and golden seal, then there's, and that one already went down, right?
Yeah.
So the over harvesting, but yeah, I know, I get it. I'm really glad. But then, the entourage effect of using an herb, the pharmaceutical company is just going to try and go like, oh, here's the one active ingredient of berberine that we need. And like, no, it's like all herbs, you have to have everybody in there to play. So we have those natural buffers that are put in.
Exactly.
Like hawthorn for my Marfs, for Marfan syndrome. Oh my goddesses, there's not a better herb that needs to be on board for just a daily for anybody with any cardiovascular thing.
Yeah.
Right?
We learned way back that helps with like ejection fraction and other aspects of cardiovascular medicine. Are you actually seeing that in practice?
Yeah, I've used it for easily a decade now. Was first digging in the rare book room there at NCNM and looking at how much has been really written on hawthorn, how important, as we know, the rose family is for the heart, and how it's the number one family that's like grown with us and involved with us to be a really important plant for us. And that self-innate knowledge in it to know blood pressure stuff. I've used it extensively for anxiety and high blood pressure, to know too, like how to bring it down but not bring it down too low, which the standard of care right now with Marfan syndrome is to be on the two kinds of blood pressure medications. And so they're on a beta blocker, metoprolol is the big one. And then losartan is the ARBs, angiotensin 2, that they got real excited about. But the scary thing is they're dropping down so low. We're already low blood pressure because we have these adrenals that have their own, issues going on and trying to keep things going. And so usually very low blood pressure already, and then they want us on a double that takes you down even low. So if nothing else, I'll use my hawthorn to try and prevent a bottom out on the blood pressure too. Not to mention the strength and the CoQ10 and improving that contractibility, like you were talking about with the ejection fracture. I know it's really helped like nourish the heart on so many levels there too, keeping the structure if going on as well with it. And I think that's probably a lot of the flavonoids that are naturally in hawthorn. And so that one being so safe, it's really nice that I can, put that one in my book or whatever and talk about it online, because there's no contraindications with that one for anybody on anything.
Yeah. And it tastes yummy as a solid extract.
Nice.
as an
Yeah,
extra bonus.
exactly. I agree. Hawthorn jelly.
Yeah.
Good way for
Well,
the kids. Yeah.
yeah. So how much is physical medicine part of your
Yeah.
daily practice?
Right. I personally used to give tons of body work to people, but I can't do it anymore. I was told to stop a long time ago because I did like sports medicine, deep tissue, and
Yeah.
but that was my first introduction to heaven and my first
Yeah.
pain-free experience ever. Not realizing how much pain was, we think this is like normal because we don't know anything else. The I guess breaking down yourself and rebuilding is definitely not, doesn't feel good. But
Yeah.
yeah, so massage was like, oh, it's so amazing. Oh my gosh, this is like an itch that never it's gotten. But chiropractic is
Yeah.
definitely a love-hate relationship.
Yeah.
That one can really mess you up hard if done wrong. But we need it in a lot of cases too. I mean, because we can go so loose to go out. The frustrating part, what the pain is that we have to stay tight. Our ligaments aren't doing the job anymore. The tendons are like out to lunch. So the muscles have to do the work to hold things together. So, you'll have a new massage therapist that thinks, oh, I just got to really get everything loose and relax. But then you get up and you like go to sleep that night and you loosen and relax, and boom, that scoliosis just is worse now,
Mhm.
or the occiput here in the back of the neck. That's one of my big problems for not listening and snowboarding and such. And
Yeah.
back in the day, we didn't have
Yeah.
helmets, right? Even with a helmet, you're still gonna like get that part.
Yeah.
But so there's this even now as I get older, even with massage, and this really should be with any. We really have to watch how deep they go because we'll get off that table and it'll be like, whoa, whoa. I have to grab something usually because the proprioceptors have all shifted so much. It's wild to think how many connections are going on through the extracellular matrix, and I think we're a
Mhm.
great example of all the communication that goes on, and how just the slightest little thing will be.
Mm.
So that's where like some of the people really like just the little activator that the chiropractor might use, or just using somebody who, like me, I would just kind of slide joints back in by deep tissue massage and just kind of convincing the joint it wants to go in. And we're so loose, we will.
Mhm.
Essentially, there's only a couple joints that you really have to. And was that OHSU just a couple weekends ago? Dr. Guggenheim was talking there in the morning. Of course,
Yeah.
I didn't make it there because I wasn't there on time.
Yeah.
But they have talked again, like, oh, first proof at 8 o'clock on a Saturday.
Yeah.
I live too far from the big city, but they're not recommending any kind of cracking anymore, and especially on the
No.
occiput. But that one is really hard if it goes out, how you get that
Mm.
one back in. And
Right.
and sometimes I can on people and sometimes so, that's where us having to be more at risk and just jump in and go, okay, let's see what happens, kind of personalities, and go, all right, just crack me, see what it should work just fine. And usually it has with my chiropractors. I'm very, very picky about them, but body work and physical is definitely required. And it's sad, a lot of my patients have had bad experiences. So we have conversations about how to educate them, like we're always really needing to do with even our own doctors. So we have to really
Mhm.
be good self advocates. And as soon as it starts to feel a little not good, just to listen to that, because we definitely can go beyond and then we don't come
Yeah.
back.
So, and how about like a Pilates practice or something like that? Is that really
Yeah.
recommended?
Yes, especially with the machine. If you can afford that, because that gives more support for things, but being very supportive, using extra kind of compression stockings or sleeves, and reimbursement, K-tape. Thank God that's out everywhere now. We can buy
Yeah.
sports tape and K-tape. And, even my massage therapist has been trained on how to tape that up and lock it in for people. So
Right.
yeah, it's been really exciting to be able to utilize more of what's happening and what we can do for ourselves.
So for you, like, what do you find hopeful on the horizon, like that you're learning about at these conferences, and anything that is coming up in the research that you're excited about?
Oh, for me, one, it's the merge that we're slowly seeing, the naturopathic kind of ways getting in the mainstream.
Oh,
And it's, people demanding it, I think, for the most part. And they're being open and seeing like, oh, this is working and helping. If nothing else, quality of life, right? That's what we're so great with. And bringing in the nutrition. There has been, I've had talks with Hell Dietz about mineral deficiencies being there. And I think and that being kind of the reason for the spontaneous, and being maybe a possibility to help bring that up. So that's something that is more like along my lines of things. One of the, but playing around with anything from like the TGF beta antagonist, and not to throw down names, but they do have a patent. Metagenics has that THIAA they make from hops. It's
oh, right. Yeah.
the tetrahydra iso alpha that they've done tons of research with for how it's messing with the signaling of TGF beta, and and they're doing it mainly with pain, inflammation, and diabetics.
Yeah.
I've been really trying to yell this for a long time. Like, you guys, we got to bring this on for Marfans. This reduces this expression. Then we're going to slow down this horrible mottled scar tissue buildup we're doing, and breaking ourselves down. So I that's definitely exciting for me, and then that avenue, as my nerdy side really wants to see more of messing with the signals. I genetics, moving forward, and stem cells are now in the play.
Right.
I did stem cells to see if I could kind of not do this. And there's some side, it's kind of like Prolo, maybe. Like, if you give it to me, did it make it better? Did it make it worse? Well, physically, oh my gosh, it brought my ankles back to me. My lungs that were always just down after COVID, were like, all back again. And I got some really great effects with that. So I'm excited to see us be able to utilize that more. I had most of my doctors really mad at me for self-administering and doing that on my own, but they're used to me doing my things on my own anyway, except for my Slovenian cardiologist, because in Slovenia, they do that. They do that right into the heart.
Wow.
Yeah. Right. So I'm like, these international things, as they do that more over there, that's going to help us over here. Or
Yes.
the genetic testing they were doing in China, where Marfan's was the first that this has ever been done with. They had 8 Marfan moms that were pregnant with little Marfan babies in their belly, and they went in, since we know fibrillin 1 is the gene, and that's why they chose us, because I guess it's just really simple. Like, oh, okay, it's just this one gene. So they went in and they genetically, with the splicing, went in and fixed that. And 7 of the 8 did not have Marfans then when they were born.
Wow.
And following them. Guess what happened to that lab? Shut down, no more. The CPP came in and took over, and God knows what they're doing, now with like all that. But it was like, oh my God, But a part of me is sad if we get to the point where there's never going to be any of these mutations, because there are positive effects that are figured out and down on paper, that we're just more open-minded and fluid and flexible in all kinds of ways.
Hmm.
It's like intuitive to being able to be more brave about and laugh things off easier. It's like, I
Yeah.
get nervous when we're like get all excited to rule out all of our different cool things that make us human
Sure.
and different, right?
Yeah. I
But
get
I
that.
know as a parent though, you're like, oh God, do I want a kid that's going to have heart surgery down the road? If you could have that option, a lot of parents would like that for sure.
Yeah. Yeah.
But we
Wow.
definitely have a lot of exciting things for as the integration of our medicines with the mainstreams come on board. Even when everybody's more open to like, oh, I want to eat healthier. Oh, I will eat my root vegetables that are loaded with minerals and my good fish and stuff now. And so I think that can actually start helping slow down the spontaneous fact that we're seeing more cases of.
Hmm.
So yeah, and
Yeah.
new stuff on the surgery table is always nice.
Yeah. I feel like we have to have a part two of this conversation, because it's just like really is just scratching the surface of. I can tell there's just so many different layers to this.
Right.
You have your practice. Why don't you tell us about your practice, and also like a
Oh,
little bit
sure.
about this ebook that you have that you kindly shared with me, and I'm so excited to read through it. It looks
Oh,
really amazing and
good.
full of great information.
Thank you. Yeah, that was based off of my thesis when I graduated my doctorate. It was definitely more nerdy, but so I was like, oh, let's put this in layman's terms so my patients can have something. And there's us doctors, we're repeating ourselves all the time, right? I was like,
Mhm.
yeah, let's get something down. I don't have to
Yeah.
repeat myself so much anymore, right? And so the ebook at drmandolin.com. Definitely, if somebody gets it, I'm happy. Share it with your friends. I am really getting the information out there for people for the most part. And my practice is in a little town. I'm in a like 100-year-old brick building, and it's a lot of fun to have people either come in. Sometimes they'll fly in to see me, and
Wow.
because I'm unique enough, and it's really a blast to see different kind of people. But for the most part, it's really heart wrenching because I'll get people like, "Oh God, I'm so glad I found you." Like I have never talked to anybody, let alone known anybody that was a doctor, that has these things. So that's really exciting that I can be in their shoes and I know what they're going through. Everybody likes that kind of a physician for sure, more so. And yeah, so I was very excited to get out of primary care after doing that for 12 years and be able to focus on just the things I love to do now. Hormones, GI tract, I got brought in, and that really was a lot of my Ehlers-Danlos people. That's like their first thing that they notice is off and wrong is this leaky gut and that type of
Hmm.
thing. And then yeah, now connective tissue disorder. So there's been a really great crossover where I've been able to really see things with using hormones, be able to really bring us our quality of life back quite a bit too, with
Nice.
estrogen and testosterone. It's just fabulous. I have a crazy case with a trans girl went to male, symptoms went away when the testosterone was
Wow.
coming up on a higher level for
Wow.
him, that he's like, oh, I don't have these muscle pains and aches anymore, and my women, I just bring up our estrogen and I'm like, we're keeping you up on a higher level and we're just going to make sure we know how you detoxify and metabolize with the Dutch test, right? Love that one. And say no, don't be afraid of bioidentical hormones. These are definitely our friends out here. So that's
Wow.
my practice, and it's really fun. And my brain, I keep getting more and more different things going on that I like to
Love
help
it.
expand for them. But thank you.
Love it. Yeah. And do you do telemed too?
Yes, definitely do telemed.
That's
Yeah,
awesome.
I love consulting, and I'm being support for people from Australia to Ireland to the
Wow.
UK to
Very
be able
nice.
to find me, because it's all kinds of people get Marfan. So
Yeah. I love that. Like when you think about, you get out of the sort of disease model and you think about like what's the body needing, and how do we support, like you say, quality of life. You can see that there's just so much to offer: gut health, hormone health,
right,
um, mineral health, supporting minerals. It's just really just a perfect example of how the two worlds of medicine can complement each other.
yeah,
I
right.
mean, because obviously a Marfan syndrome patient can't do without a cardiologist, being on the team. Like it's just, and
As much as we might fight,
yeah, yeah,
they're like,
and
"Oh God, Amanda, you're just using Hawthorne for your beta blocker." I'm like, "See,
yeah.
it works."
Well, you're teaching them and educating them too, so that's.
Yeah.
I'm sure they're learning a lot from you.
Oh,
But
thank
yeah,
you,
this
Doc.
has been really wonderful. Thank you.
Thank
Is there
you.
anything you'd like to kind of leave us with? Like, we're going to put all the links to, your contact information and social notes, and even to like your supplements that you're developing, and all that in the show notes. But I'd love to kind of, if you have any take home messages you've left. I'm very inspired by this conversation, so I'm sure other
Oh,
people are.
thank you. I appreciate that. I think that we all have a little bit more of intuition. So I definitely tell my loose connective tribe, like, I think there's a reason why you're more loose. So, be take, really appreciate that side, and be careful about getting stuck in the conventional medicine, because I will see that route just continue to uh, get you stuck farther and farther down that rabbit hole, right? So I would definitely bring on some of us alternative practitioners, and a naturopathic physician who's been well trained as in herbs, in homeopathy. That there's so much more there to offer, and get your support team on board. And there's I have a free little grab thing for just on calypsoclinic.com. That's my Calypso name. Just a PDF of foods that are like that we need. More antioxidants and high minerals is really the thing there, and eating a lot, because we're breaking ourselves down. We have to have a lot of small meals throughout the day,
Mm,
and really make sure that that the kids are getting that. The little Marv kids, when they say they're hungry, they really are. Just keep feeding them. They're gonna put you take the credit cards out, because that's what it costs to feed
yeah. Wow.
them.
Wow. Really good
But
insight.
thank
Yeah. So I'd love
you.
to kind of revisit another time down the road to go into some other
Please.
elements. But thank you
It would
very
be
much
fun to
for
do
being
that with
here.
you. Oh, I appreciate you and your audience. Thank you guys so much. Please reach out. Happy to be of a service to your audience here in any way I can. Get to know
Awesome.
my email for them. Awesome.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from that. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.